Welcome to RMD All Things Aesthetics and Wellness podcast with me, your host, Dr. Debra Durst, and my co-host.
Hey guys, Faraday here, nurse practitioner at Revitalize MD, and today we are going to talk about hair restoration. It is a hot topic around here. Everybody wants full, beautiful hair.
Yes. Well, you got to keep it that way.
Right?
It does affect confidence when your hair starts to thin. That's a big deal. And again, I think that this is a necessary treatment, even if you're not really noticing thinness, but we know that happens with age and you just want to keep it healthy and thick and
beautiful.
And
right?
beautiful, right? So
nobody looks great. Females don't really look great bald, right? Like I would spend all my money to keep all my hair.
Yeah.
Right?
Yeah.
It's one of those things.
Yeah. No, I agree.
I can't do.
No.
Can't do without.
No, I agree. I mean, I think it's important that I think people, when they start to notice thinning, are walking around thinking about it all the time.
Absolutely.
And I think that's something that is on their mind and they think everyone's looking at it, but they're not. They're not looking at it.
And it's definitely been something that's come up more recently in the last few years following certain viruses. We've heard a lot about hair shedding after illness.
Yes. Yeah.
More so, like I said, over the last few years than prior, I feel like. So it has been a very hot topic in our office.
So what do we do for, stimulating hair growth and hair restoration treatment? So we started off at first doing PRP, but now the core treatment for us at this office is PRF, hair restoration. And so we've done another podcast on PRF and what PRF is. So PRP is what a lot of offices are doing. That's first generation. And second generation is PRF. So we're basically processing that PRP differently, and it's platelet-rich fibrin. And so basically when we inject it, it forms a clot and that stays in place and releases the growth factors over a much longer period of time.
Absolutely. And you can listen to our podcast on that. If you go to our channel, definitely hit the bell, like, subscribe. Our camera guy is like so proud of us today because we're saying it
early on.
on in the video. That's what he stresses. But we really do appreciate you guys. Please do like, subscribe, send to friends. Sharing is caring. It helps us grow the channel.
And then you'll get alerts to anything that we are putting out there. And so PRF, again, our results with PRF versus PRP are amazing. And it's because, again, you have additional components in the PR or the blood product, that we're injecting. And it forms a clot. And so the platelets and the fibrin are in that matrix where we injected it. It stays for 2 or 3 weeks and releases growth factors. And our whole goal in hair restoration is getting that hair follicle out of the resting phase and into the active phase. And not only that, but also prolonging the active phase and decreasing the resting phase. So that's why we do it every month for 3.
So when we talk to people about hair restoration, we always want to stress, there are hair cycles, right? You're not going to get a PRF treatment and then see hair grow the next day. Hair grows typically in different phases. So there's 4 different phases of hair growth. There is the anagen phase, which is that active phase. So that's where your cell division is occurring. That's where the hair is actively growing. So that stage, your hair can grow anywhere from a half an inch to an inch during that phase. Within that time frame. So whether that's monthly, every 6 months, if you're lucky, and you don't have that phase disrupted, that phase can last up to 5 years. You can have active hair growth. So what I've seen is as much as 6 inches.
That's where we want the hair follicle,
right?
That's
where we want it. Where you can have up to 6 inches of hair growth in that 5-year time frame, which is amazing for anyone who's trying to grow hair. The second stage, it's considered a transition phase. It is the catagen phase. So it is where the hair is going from being active and transitioning into that resting. So the biggest thing that happens during this stage is that the blood flow is cut off from the hair, from that supply, so that it is not actively growing anymore. And then it goes into that telogen phase, that resting phase. And that is the phase that we do not want to stay in because that phase can last 3 months. That's a long time of no hair growth.
And that's why we want to actually do it once a month for 3, is because we want to try and catch the hair follicles, in a phase where we can actually communicate with them and then get them out of that telogen phase.
Yeah, because
And
they're
so-
still in the hair follicle at that time. So they haven't shed yet. They haven't left the follicle. The hair isn't shedding out. It is resting, but it is still in that follicle. So we can force it into an active phase again.
And I think that, again, hair growth is long, so you don't expect results immediately. And we always say 3 weeks to 3 months is a regenerative phase, but honestly, you're looking at longer with hair. And so it may be that you see nothing for 3 months, but at 6 months, you're seeing something. And so the chances of us getting that hair follicle in a telogen phase where we can convert it, if we do that once a month for 3, we're more likely to hit the hair follicle where we need it to be and then convert it over. So,
and then that last stage is the exogen stage, which is where the hair actually sheds. It leaves the follicle.
Yeah.
And then the cycle starts all over again. So what we're trying to do is prevent that stage, right? We don't want to lose hair. We're all going to shed some. That is normal. That is natural. We just don't want excessive shedding.
Anagen's my favorite.
Well,
I'll just say it's my favorite phase. I wanted to stay there forever. So
forever.
Yeah. So I will say that our core is PRF treatment. So that's what we want to do. And it's because we can, again, you're regenerating in the hair and a little different. And that's why we're going into the different phases of the hair follicle and the hair cycle, is because a lot of times we're just talking about collagen, elastin stimulation, nerve and blood flow. And of course, we're going to get increased blood flow to the scalp. But really what it is we're talking about affecting the hair follicle and the growth. And that's different than a lot of our other regenerative PRP or PRF procedures. And so that's our core. So we recommend that to everyone.
Yes.
And again, once a month for 3 as a treatment.
And then we go from there.
Yeah, and then we go from there. I mean,
but we're seeing amazing results
Mm-hmm.
in that time frame. Some patients are extreme responders, and we see hair growth at that 1 month when they're coming in for their second. And but at that second and third, we see that continuous progress. But I think it's so important to understand the phases of hair growth so that you have realistic expectations when you're getting these treatments.
Yeah.
Because we all want it right now, right?
Yeah.
That's TikTok. That's these shorts. We're on 60 seconds.
It's the US.
We want it now. We want it immediately. But hair is not an immediate thing unless you're doing surgery and you're waking up with it because of a transplant. But that's extremely expensive and not guaranteed when you can
and timely, really, because it's immediate, but not really.
And we see patients who have had them and the hair's fallen out.
Well, so we do see a lot and do a lot of PRF treatments, in those patients, so that we're actually, again, doing all that beneficial hair cycle, effect. So basically that's the core. If you have some hair receding in receding areas, then that's more severe. Men with more severe loss, and men do tend to have more severe loss because male pattern baldness is definitely progressive and more severe than female pattern baldness. So just some thinning in the middle. But so exosomes sometimes we'll recommend for that, but we definitely want to hit it in other areas too. So topical, or supplements like Nutrafol we use as a supplement so that you're hitting every aspect that you can. Absolutely. You have nutrients for the hair follicle. You have the PRF treatments. We can add laser to it as well.
We use Carolase to make those little microchannels to help stimulate growth.
And then you're actually putting in some, peptides as well topically after you create the microchannels. But we usually don't recommend it just as a standalone because unless somebody has like a really small area of thinning, because PRF's the core and those we're adding to that. But even a hydrofacial for the scalp, like a hydroscalp is what we call it. I mean, think about all the products we put on our hair
just to
on a daily basis.
Get all the junk
out.
Get
that junk out and let your hair follicle breathe again.
Yes.
And so that's helpful, and it's not something that people talk about. You don't have to do a hydrofacial where you're putting all the topical stuff on where it drives up the cost of the hydroscalp, but just clean the stuff out, get it all out. So it's important. I think that's one aspect that we probably don't think about enough.
Right.
So
PRF is so effective. I think it is a go-to, but supplements like Dr. said, Nutrafol's great. It looks at vitamins, A, D, E. It's zinc, it's selenium, it's biotin, iodine, saw palmetto. There's so many, ashwagandha.
Then it'll have all those like omegas that they'll have some proprietary, blend that's like fish related stuff or marine and getting all those omegas too.
But even that, we're recommending at least 3 months on that product. So you're going to hear this.
Love that product. Yeah.
It's honestly why we started carrying it.
Yeah.
Because patients were loving it so much.
Yeah. They came to us because we had a different supplement. And I think both of them did well, but people really loved it. And so the other thing is topical, because a lot of times you'll hear about minoxidil. Minoxidil was a drug used for high blood pressure, and then it had some hair growth, so people started using it topically. But then honestly, we have a product and it has like 5 different ingredients in it. But I think minoxidil is one of them, but finasteride can be one of them, or a peptide, GHKCU. But the thing with finasteride is you don't need to take it orally to affect something locally on the scalp. So,
and it can have some negative side effects when taken orally.
So be careful, because a lot of people will just Google and start taking things without knowing. So the other issue is that with finasteride is that DHT, which can cause the issue, can concentrate in the hair follicle even if it isn't high in the blood. So taking it topically is another aspect to hit that hair growth. So anyhow, does that kind of wrap up everything?
A little bit. So I think it's important to know that minoxidil, what does it do? It shortens the resting phase and activates the growth phase.
Yeah.
Right. Yeah. So that's what all of these products are trying to do, is activate that growth phase. And that's why minoxidil, or Rogaine, as we know, is over the counter, has been so popular.
Yes.
Great marketing, and it works for a lot of people.
Yeah.
But it works so much better when we take it and we combine it with caffeine and melatonin or tretinoin or finasteride or any of these other products that we can do through compounding pharmacies to help further activate that growth phase.
And those are things that you don't often hear a lot about, but people will get a finasteride, or they'll get a minoxidil, or you'll hear GHKCU. But if you can combine things in one product, and then melatonin, like you mentioned, caffeine. And tretinoin are things that have some studies that support hair growth and just aren't used as often. So we love a product that has 5 different ingredients. And again, we can use that peptide or finasteride, whichever one we think is more important with that patient. But amazing. You got to hit it from every angle, because hair is hard to grow.
Yeah. And yet it's one of the more difficult things to do.
Yeah. We're convinced that, we love the results that we have. But again, the more aggressive results that we can get, the better. Yeah. We want great results for hair. I think that's it for hair restoration. So subscribe, leave a comment, any experiences you've had with PRP and PRF. And I'm sure that there are a lot of people out there that want to share their experiences, because it's quite popular. And let us know. So if you want to hear any other topics, let us know as well, because we are willing to deep dive into anything aesthetics and wellness. Thank you.